My name is Mallory Cyr. I am the Youth Program Manager for Got Transition, which is brought to you by a cooperative agreement with HRSA and the Maternal Child Health Bureau. I am so excited for today's episode. Although I was flying solo last month, this month my co-host Teresa Nguyen is back with me. And we also have a very special guest speaker, my own younger sister, Maisy Cyr. And I'm so excited to have Maisy here today because she just returned from spending 5 months studying abroad in England. And she did all this while managing her own complex health needs and healthcare. And so I know that she learned a ton over there. And I'm really excited for her to share some of her lessons learned with our listeners and to be able to maybe answer some questions that other people may have about a similar opportunity. Before we get started, as always, I want to take a moment to go over some quick housekeeping things so that all our listeners can get their question answered and join in the conversation. On your webinar control panel on the right of your screen, you will have a window that says questions, and you can type any questions or comments into this box, and Maisy, Teresa, and I will do our best to refer to them throughout the episode and make sure that they get answered. Any comments or questions that do not get answered will be answered separately and archived on our website, gottransition.org. So here at Got Transition, we always talk about healthcare in a clinical setting, but we also acknowledge that for young people, healthcare management really needs to be framed in a way that is meaningful to them. And a lot of times we need to put things in perspective so that it is about staying healthy so that youth can do the things that are important to them, even though that may not always be so easy. So Maisy and Teresa and I have all been presented with some pretty amazing opportunities in our lives, only to discover as we went forward that those opportunities were not necessarily designed for people who had special healthcare needs or disabilities. So when we got to this point, we had to make a decision. Do we figure out how to make this opportunity work and pursue it? Or do we let our medical needs limit what we do in terms of recreation or leadership development? So we decided that this would be a great topic for today's episode, and we hope to provide some tools and strategies as to how to make those decisions confidently, and we hope that you leave feeling empowered and believing what might be possible for you or the youth that you know. So all of us are so proud of Maisy for accomplishing being in England for all that time by herself, and we as her family know that it definitely was not easy, but she definitely made the most of those challenges and had a pretty good time overall. And so it definitely took a lot of work from a lot of people. So I would love to welcome Maisy to the show and have her share what she learned during that time. So welcome, Maisy. Hi.
Hi.
Can you share a little bit about your experience in London and tell our listeners from your experience what went well and what would you have done differently, and how did you prepare for such a venture?
Well, at first I knew that I wanted to study abroad, so I had to do sort of the academic side of things, which was a ton of paperwork and all of that. But then I realized I was going to have to sort out sort of the medical side of things to make sure that was taken care of, because obviously that had to be my priority. Whereas for, some other kids who might have wanted to study abroad, they could just sort of do it. And so I think the first step for me was communicating with my doctors, my TPN delivery companies to see what they could do and how we could work that out overseas.
And I'm sorry, just to back up for 1 second, can you explain a little bit about what your health needs are, what it meant for you to have to, what sort of things you had to manage?
Yeah, of course, sorry. So I have microvillus inclusion disease, so I don't absorb vitamins and nutrients or anything from food, so I have to get it intravenously every night. And so that involves setting up IV tubing and making sure I have enough fluid on hand to keep me well nourished and hydrated and everything. So I had to sort that out, and then while I was over there, make time to set it up and ensure that I was taking care of my own health even though I was in another country. And to try to bridge the gap between my health care here and what I would have available to me over there. And I think one thing that was interesting was the insurance aspect of it. For study abroad, you get like a specific study abroad insurance, but it doesn't cover congenital, what's it called now?
What they like to call congenital abnormalities.
Right, which basically just means like pre-existing conditions. So had I needed to use it, I might not have been covered in a way that was actually useful to me. So that was kind of an obstacle, but luckily I stayed pretty healthy while I was over there. But one thing I was nervous about was navigating the differences in the healthcare system there, because they have NHS, and because I wasn't there for more than 6 months, I wasn't covered under it, and so that was a little bit complicated, but like I said, luckily I didn't need any serious medical care while I was there. So yeah, and I think the biggest thing was just making sure that I had a support system on both ends. So making sure I had someone to go to in England should anything happen, and having that support from my doctor and my delivery company back in the States, and just really communicating with them. And even that was difficult because I didn't have a cell phone I could use to call, overseas. So I had to get everyone's emails and make sure everyone was on the same page before I left, and make sure those lines of communication were open before I, could even get to England. So, yeah.
And I know that at one point you had to seek medical care just for some routine blood work and things so that you could keep getting your infusions. What was that like, accessing care in another country?
Well, one thing I wish I would have done way, in the beginning was sort of associate myself with the people at the health center at the university. I think when I first got there, I just sort of got wrapped up in like the touristy end of it, and being a new student in a new country, and somehow that just slipped my mind. And so a few months had gone by, and I did need just like some routine lab work done, and I didn't really know where to start. So I ended up getting a consultation from the health center, and I did have to pay for that out of pocket, but it was no big deal. And they sent me to a hospital, which ended up being right across the street, and they were actually really, really helpful. And they sat down and they listened to, my story and all the complicated information that had piled up over the 19 years I've been alive. And they were able to send me to the place across the street where they could do my blood work and get those results back pretty quick. So it was just a matter of finding the, I guess, motivation and sort of courage to actually begin to navigate the system over there and figure out who I needed to talk to get what I needed. But it can be intimidating sometimes, but gotta do what you gotta do.
Yeah, and I think we all know that, you know, we talk about healthcare so much, but, you know, in my own experience, like I've talked about on the show quite a bit, is that it's not always, you're not always able to make it a priority, and then you look and so much time has gone by and you're like, oh my gosh, I haven't even done that yet, and it feels like I just got here. Um, so along with your lessons learned that are on the slide on your screen, what advice would you give to other young people who might want to pursue an opportunity like that but have, you know, complex medical needs or a disability? Like, what's your one takeaway of something you wish you had done differently?
I think really make sure you know sort of the situation you are getting into, and sort of what to prepare yourself for. I wish I could have, like I said, better sort of associated myself with the health center right away and sort of had that on my side from the very beginning. I was lucky and fortunate that they, you know, were so helpful right away. But just really, I think communication is the biggest thing I can stress. I know it is on the slide, but make sure you know who's on this side of the ocean for you and who's going to be on the other side, and just really planning and making sure you have some sort of structure as far as making sure your medical needs are taken care of. But definitely don't let it, you know, hold you back in any way, because there are ways to make things happen, I think. So just be prepared, you know.
Awesome. Thank you so much, Mace, and I know that that experience has definitely taught you a lot, and I think it is a great learning experience. And Teresa, my lovely co-host, has also had some experience, and where Maisie's experience luckily panned out with no sort of bumps in the road, and, you know, everything went well. Teresa sort of had the opposite experience, where she had some opportunities that, although seemed to be really exciting at the time, turned out not to be so great. Teresa, I would love for you to share kind of the opposite end of the spectrum and some of your lessons learned.
Sure, definitely. First off, I just wanted to say, awesome job, Maisy. I'm really jealous you went to London, and it seemed like a great experience for you. My story, so I accepted a fellowship opportunity in DC last summer, and after 2 months of struggling to find accessible housing, I decided the opportunity was not right for me. The challenge was I found that the accessible and affordable apartments were not only in unsafe parts of the city, but that they were also about an hour or more away from my healthcare providers. Accessibility is pretty complex for me. As a wheelchair user, I definitely rely on things like a rolling shower or a lower kitchen countertop. But it also means to me that I can easily get to my doctor's appointments in a timely manner, or get medical help as soon as I needed it. And as someone with a complex medical history, I know that being far from my providers was not a good option, as I was trying to navigate an unfamiliar city by myself. Had I established a reliable support system in DC, I might have been more comfortable with living a little bit farther away from my providers. But that was not the case for me. I was very, very new to the city and didn't really know anybody. I realized that my safety and health are always my top priorities, because essentially that's what enables me to be successful in everything else that I do. So unfortunately, when I brought these concerns up at my fellowship, I felt unsupported and decided that this was one of those times where I needed to say no to an amazing opportunity. So, sometimes I just want to be able to do things on a whim or wing it like any other 20-something-year-old, but I think with a disability there's a lot of preparation around something as big as traveling or living abroad.
And Teresa and I had, this is Mallory, Teresa and I had such a great conversation when we were preparing for this episode about, as Teresa referred to it, the many meanings of accessibility. And when we talk about accessible housing, it's not, or accessible travel, it's not necessarily just about ramps and elevators. It's about access to medical care, access to a support system, understanding providers, and things that make you feel safe and that you can take care of your health. So I thought that was really interesting and sort of put a new dimension on what we think about accessibility. And the other thing about all of these opportunities is that key point that as young people, we are not given the liberty to necessarily just go off, quote unquote, and find ourselves. Maisy and I used to joke when we were younger that, we never would run away as kids or like pretend or pack our little red wagon and be like, we're leaving, because we knew that where are we going to go without, a few days of IV fluid. So we just knew, even at a young age, that things like that took planning, and vacations were a big deal for our family, getting medical supplies shipped, all of those things. Even now, if I go somewhere for a weekend, I have to make sure that I have all the medical supplies in both places that I need. So it's constant follow-up, constant planning, and you have to really want something in order to really commit to those steps. So the other thing we talked about as we were planning this episode is that Maisy and Teresa and I are all very outgoing, outspoken, driven young people. And so we started thinking, well, you're not born that way. How can young people get to a point where they feel confident and excited about taking advantage of opportunities that might need a little more navigating and follow-up? And it really stems from what can be done at a young age. All the things we talk about in terms of healthcare transition, giving responsibility at a very young age, building that self-determination and confidence around identity and understanding your illness at a young age, being able to advocate within your peers. As parents, letting your young people take safe risks. Maisy and I went to summer camp. We had sleepovers. We did things that, maybe our doctors wouldn't have said we could have done, but we were doing safely, and that gave us the confidence as we got older to realize that more and more things were possible. So I also want to refer you to a great resource on the Got Transition website that we call our Readiness Assessment, and it breaks down a lot of those small steps in terms of healthcare transition, but it also can kind of give you an idea of those things that can start to build that independence and that responsibility. And as all three of us have said, as with every aspect of transition, it all comes back to planning, preparation, and support. None of us could have done any of the things we've done by ourselves, and we know that and we recognize that, and it's about identifying supports where you're going, supports along the way, supports at home, and really just having that circle and having your Rolodex of people you can go to. And planning and preparation. I say it all the time. I'm the queen of lists. I just made a to-do list at 4 o'clock this morning so I could go back to sleep. Preparing, knowing what's ahead, knowing how you're going to handle certain situations. It all comes back to that. So I want to extend it to our listeners for any questions. We did have one question come in for Maisy, and I caught this as well. You mentioned, Maze, about the NHS, and you said that you weren't covered under that. Could you elaborate on NHS, what that stands for, and also what differences you might have seen in the care delivery while you were traveling in England?
Yeah. So NHS stands for National Health Service, I believe. Like I said, I was lucky enough to not have to navigate it too much, so I only sort of skimmed the surface. But basically, if you live in the UK, I think they have like universal healthcare, so basically your care is covered. But because I was only there for 5 months, I didn't need like a student visa or anything like that. So basically I was there as temporarily as you can be there and still be allowed in the country. But I wasn't covered under their healthcare, which is why I needed the insurance. But when I did go to get my blood work, though, it was very like, it was a very sort of casual atmosphere. Like, I just walked in and told them sort of what I needed, and they took my information and did their thing. But it wasn't, I don't know, it was different. There wasn't as much like paperwork to it. I got my results where they needed to go. I don't know if that really answers the question, but...
Yeah, definitely. And Teresa, I know you have done some traveling too. Do you have anything that you want to share, or have you had experience accessing care in other countries or different areas that you want to share?
Fortunately, I had not had to access any, healthcare facilities in other countries. And I think if you guys go back a couple episodes, I did share an experience I had in another state, in Missouri, and even I realized that in another state, healthcare could be a little bit different than what I've been used to in Colorado. And so I guess my tip there is, again, do your research before you travel, and know where you can have access to healthcare, and know what the policies are regarding insurance and that kind of stuff before you travel. It's a little bit tedious, but it definitely helps.
We do have another question for you, Teresa. With your lessons learned from the experience that did not work out, would you say you are more or less willing to try another travel or employment experience that is away in the near future?
I'm really thankful for the lessons that I've learned during, this kind of fiasco. But it does, oddly enough, make me more willing to try to go on another travel adventure, or, seek employment out of Colorado, definitely. And I think that one of the things that I'm more confident now after this lesson is that I can set boundaries, and I definitely know what to look for now, know the right questions to ask, and again, it's just about communicating to, all of the people that are involved to make sure everybody's on the right page and that you're being supported as you make your move, or as you're making your excursion abroad.
And I think, too, one thing that I've seen personally a lot lately in my own experience is that when we have negative experiences like that, it really serves to give us insight into what does work and knowing what we don't want. And I think the only way to truly value the positive experiences and to understand what does not work for us is to have those experiences that don't work, where we have to put our foot down and say, okay, this is not working for me. I am going to advocate and remove myself from the situation. So I think that's a really good question because it really is in what you take away from it and how you look at things moving forward. And I think all of us could look at our own lives and go, you know what, wow, this is really hard. I'm really tired. I have so much to do. I'm done. I'm just, I can't do it anymore. I'm just going to hang out at home and, let other people do things. And we all have those days where that seems really appealing. But I know in my case, then there are so many things I want to do and see, and you take control, you get back in the driver's seat and communicate with who you need to communicate with and move forward. So I do want to share some great resources that we found, and we sort of discovered some of these together as we were planning for the episode. The first link is a really great website put out by TSA, which is Transportation Security Administration, I believe, and it maps out all the very specific procedures for different disabilities and medical conditions. I know Maisy and I have to, do certain things when we travel with our IV fluid, and people who use mobility devices have to get screened excessively, and we all sort of laugh about that, but it can be kind of a pain. But this really helps you prepare and know what you're going to experience at the airport. And if you have any questions, there's a support hotline that you can call, which is great. The other one links directly to some travel agencies and organizations that help you plan trips abroad when you need accessibility. So those are really exciting. The last one is one that Teresa has used personally. Mobility International, they do a great publication around people with disabilities studying abroad and what different opportunities there are. So I highly recommend you check out all of those. All our contact information is here if you think of specific questions after this episode. As always, our past episodes are available on our website. They're also available on iTunes. And if you wouldn't mind, that link right there, I'll paste it in the chat box if I can. Our 60-second survey to give some feedback about Got Transition Radio and what your thoughts are as you've been listening. And of course, our Facebook page and our Twitter and our website posts all our upcoming events, everything new that is happening with us. And we encourage you all to tune in to our last episode in this round of Got Transition, which will be in June. The date is to be determined. But my co-host Eileen Ferlenza will be back, and we will do sort of a year in review wrap-up with Got Transition Radio. I can't believe it has gone by so fast. But with that, I would love to thank our guest presenter, Miss Maisy Cyr. Thank you for being on. And my lovely co-host, Teresa. And with that, if there are no further questions, we will sign off. And remember, every transition is unique, just like you. Thanks for tuning in.
Thanks, everyone.